Hi everyone, I'm here with Ms. Chavez at Family Practice Center. Hi.
Hello everyone.
And Ms. Chavez is going to help us through some frequently common questions that our patients usually make. Ms. Chavez, does the flu shot make me sick?
The flu vaccine is, well, first of all, the flu season is right around the corner. So usually the flu season starts anywhere from October to about February or a little later than that. So yes, it's very important for us to discuss the vaccine, the flu vaccine. And despite knowing that the flu causes severe illness and it could even cause death, still only about 50% of the population gets vaccinated every year. And why is this? You know, I think it's because there's a lot of misconceptions regarding the flu vaccine. So we're just going to go over a few of the misconceptions.
What are some of the, like, people usually think that the flu shot doesn't work. Can you explain us why would they think that?
Okay, so the flu vaccine, it's not a live virus. Therefore, it cannot give you the flu, because it's basically an inactivated strand of the flu virus. So when you are getting the vaccine, it's not a live virus, so it cannot give you the flu. What it can give you, just like it with any other vaccinations, the flu vaccine can give you fever, it can give you muscle soreness, and it can also cause cold symptoms. And because of this, people may think, hey, it gives me the flu, but it's not actually.
Yeah, people usually think they're getting sick with the flu after they get the shot, but it's something completely different.
Right.
It will be like the side effects of the flu shot.
Exactly. And also when you get the flu vaccine, it takes about 2 weeks for your body to build immunity. And if you were to get the flu, when you get the flu vaccine, is probably because you were exposed to the vaccine prior
to getting the virus. So, like, if you get sick of the flu, it's because you were exposed to.
You were already exposed prior to getting the vaccine. You were already exposed to it.
To the virus. Okay.
Yes,
oh,
exactly.
okay. I get it. I get it.
Yeah.
I misunderstood. Sorry, everybody. Okay. One of the questions that our patients make is, I got the shot last year. Why should I get it again?
Okay. Because the flu vaccine, the antibodies do not last the entire year. So this is the reason why it is important for people, especially with chronic conditions, get the vaccine yearly, because it doesn't last in your body the entire year.
You have to renew it.
Yes.
And plus, one of the things is that there are always a new evolution of the virus, or like another type of flu that is coming out, so we need to get vaccinated with that, correct?
Right, exactly. So that was one of the other misconceptions.
Okay.
That the flu shot doesn't work.
Okay.
But what happens?
But it's because we need a different type of vaccine, right?
Right. So what happens is that the flu vaccines are developed 6 to 9 months prior to the actual flu season beginning. And so sometimes it is difficult to pinpoint exactly what strand is going to be more prevalent with every flu season. Yeah.
Okay.
But if you were, you still get the flu vaccine, and you were to get the flu anyway, it's a different strand of the flu, because there's different strands. But if you were to get the flu, the illness, it won't be as severe as if you never were to receive the vaccine, which is very important for these patients who have chronic conditions. Exactly.
Yeah. Like for example, what are the most conditions that people tend to face if they don't get the flu vaccine? Like, I know for sure pneumonia is one of them.
Pneumonia, yes, exactly.
Is there any other complications that come to, like, if they get sick, especially the senior citizens, like when they become older, or the children? they're more sensitive to other illnesses and complications. Can you mention some?
Well, basically the most important one would be the pneumonia. So we're trying to prevent you from being hospitalized with the flu, because when you get the flu vaccine, the flu, you develop a lot of symptoms. You know, you get, you know, cough and fevers, and it could develop into a pneumonia.
Okay.
And so, yes, that's what we are trying to prevent, mostly pneumonia.
And even if it's just a common cold, it doesn't hurt to go and visit your doctor, right? Because they'll know exactly what it is, and they can assist with the proper treatment.
Exactly.
Okay. Does the flu vaccine contain any dangerous chemicals?
The flu vaccine, it does not contain any dangerous antigens that cause illness. The people who should not receive the flu vaccines are those who have had Guillain-Barré syndrome or disease, and this is a severe paralyzing illness. Those people should never receive the flu vaccine, and also people who have allergies to eggs. Those are some of the chemicals.
Yeah, the chemicals are in the,
So those people who do have allergies to eggs, of course, should probably not get the flu.
Okay.
vaccine.
All right. Who do you think who should get vaccinated?
So what is recommended and approved, it's approved for children who are 6 months of age and older, and especially people who have chronic medical conditions such as diabetes, which is a large part of our population, people who have heart disease, people who have liver and kidney disease, pulmonary disease like asthma or COPD, and some neurological conditions as well.
Okay. Can you explain why they can't? No, I mean they should get it.
Because they're more prone to becoming ill, because their immune systems are not where they should be because of the chronic illnesses.
Okay, so as they get more, they will get sick more than any other person that healthy.
Yes,
person.
probably. That they will get.
Okay, so everybody, we should take care of ourselves. We don't have to let this pass by just because you think it's an illness that it will go away with just over-the-counter medicine. Like it's not. Honestly, it's not. Like I personally have heard of people dying of the flu. And it's very sad in the among the family members, some sudden death like you didn't expect it, and just because you thought it was just a common cold. And
exactly, and also if you get vaccinated, you're protecting your family as well.
Exactly.
You build the antibodies against the flu, protecting your family.
Yeah, so come by to the office here in McAllen, 501 N Ware Rd, and come and see Miss Chavez for your flu shot or any other of our health providers. Call us 956-668-0044, and thank you for watching.
Thank you. Bye-bye.